Some people are a little bit surprised to find out that there's so much stigma around mental health in healthcare professionals.
Yeah. And I think that psychiatry, the practice, we have to be kind of honest about our history. And psychiatry has a very sordid history, and there have been human rights violations and things like that. And so I think that we have to rebuild our reputation. And so I think that it exists in the culture. And I think we are part of that. I think even psychiatrists, we have these biases that we have to address. So I think that the stigma is present pretty much everywhere.
So how do we tackle the stigma?
That's a good question. I think that we talk about it more. That's number one. We try to make the resources necessary for treatment of mental illness embedded in the workplace in some situations. You talk about employee assistance, but in reality, sometimes then the physicians or healthcare workers are going to be more scared to access at their own facility. So what is the network for a physician who wants to seek mental health and maybe wants to go through that avenue? A list of psychiatrists, therapists that are recommended. We've got to compile our resources and make them available and just really keep talking about it. And I also think that we really need to be starting to talk about it, about depression, about alcohol use disorders, substance use disorders in our profession from the time that someone's in medical school. We need to hear about this early on and continue to talk about it throughout the cycle.
And why when they're in medical school? Why start then?
I believe that if you start talking about it and try to start normalizing it early on, then that helps them to, from the front end, understand that depression is an illness that is more common among physicians. And you may experience this. And here's what you should do or might do if you were to experience it. Alcohol use disorders and substance use disorders are common among physicians. So here is what you would do and how you might help a colleague. I think that letting the students know that these are things that you might encounter in your career. You may be faced with some of these problems and you may have suicidal ideation, and many of your other colleagues have as well. I think that we are such creatures that we need to not feel like we're the only one. And so I think that if people that you trust and respect say, hey, I suffered from depression and I'm feeling better now, I think it really helps to put that seed in medical students, residents' minds that Dr. So-and-so overcame or is feeling better, and I can do the same if I ever experience that.
For us, by us, and just for us, this is Hope for Med.